Well, since the implementation of the Affordable Care Act, New Yorkers on average have seen a reduction in individual market health insurance premiums, but still not everyone's happy about the new law, so one lawmaker in Washington has introduced an alternative option. WENY Washington correspondent Lauren Adams has the latest on the debate.
This bill is fundamentally flawed.
This law is working.
President's health care law continues to wreak havoc.
We're not repealing it as long as I'm president.
But that isn't stopping some Republicans from coming up with their own ideas. Pennsylvania Congressman Mike Kelly says he has an answer for those who are upset about the law. He's introduced the American Health Care Reform Act. It's what he calls a patient-centered alternative to the Affordable Care Act.
What we don't agree with is a plan that requires young people who really are saying, I don't need this plan this way right now and I can't afford it, for them to participate.
Kelly says the American Health Care Reform Act would fully repeal the current health care law. It would permit Americans to shop for health insurance across state lines if they found a cheaper option in a different state. It would allow small businesses to pool together through association health plans, granting them the same buying power as large corporations. And it would put those who buy insurance on the individual market on more equal ground with those who get insurance from an employer. But not everything would change.
In a lot of the parts of the Affordable Care Act, keeping children on until they're 26, we agree with that. Allowing people who have pre-existing conditions to be on there, yeah, we agree with that.
Kelly says the American Health Care Reform Act would focus on the most important thing.
Let's make it about patients. Let's make it about the patients and their families. Let's make it about the patients, their families, and the doctors that they rely on to make decisions on their life. That's the key to it, and we can do that.
Kelly said they're still working out the details of the new legislation, and he wants the American people to weigh in and hear what they want in health insurance coverage before taking it any further. Reporting in Washington, I'm Lauren Adams.